Okay, I am Allie Brown. I'm a pathologist and the Chief Officer for Medical Quality at ASCP. And Dr. Rohde, you want to introduce yourself?
Yes, I'm Dr. Rohde, Rodney Rohde at Texas State University, and I'm Regents Professor and Chair of the Medical Laboratory Science Program.
On behalf of ASCP, we'd like to welcome you back to the Building Bridges Across the Laboratory Community Series. The series is being launched in collaboration with the CDC as part of the One Lab initiative and with the goal of building bridges between laboratory communities in order to collaboratively tackle public health emergency responses and laboratory workforce challenges.
And today's case study will be presented by Dr. Juan Gomez, presenting on how his academic research laboratory at the Texas State Department of Physics supported a multi-partner collaborative effort to 3D print nasal swabs in response to an urgent need for additional nasal swabs for increased COVID-19 testing capacity for the city of Austin during the pandemic.
Yeah, we're excited to hear about this initiative. But before we get started, there are a few housekeeping notes. All lines will be muted. So please, if you have any questions for the panelists, go ahead and put them in the Q&A chat box. And Dr. Rohde and I will go ahead and moderate those questions in the second half of the session. Closed captioning for this webinar is enabled for any interested parties. And presentation slides, a short summary of the case and the entire recorded session will be available about 2 weeks from this date when this session is airing. Finally, we'd like to acknowledge that this resource was made possible by funding from the CDC. If we can go ahead to the next slide. We don't seem to be advancing slides, but I will say that we are very grateful, here we go, for the CDC for this funding. However, ASCP is solely responsible for its content, and the viewpoints shared do not necessarily represent those of the CDC. With that, we'd like to briefly cover the format of today's session on the next slide. There we go. So we're going to start with an introduction of our expert here, who's going to give the presentation, an introduction of the problem and challenge faced, followed by the case study itself, lessons learned and best practices that hopefully we all can learn from and apply to our own practices. And then we'll go ahead and go into the Q&A. And then we'll have details on next month's case study, which we can't wait for you guys to participate in, along with some links to the One Lab Network and One Lab Reach. Okay. Next slide. Here we go. So go ahead and ask our speaker to go ahead and introduce yourself and go on into your case study. Thank you so much for joining us today.
Well, good morning. My name is Juan Gomez. I work at the Department of Physics at Texas State University, and I want to do a quickly presentation on how we work on making COVID test swabs during the pandemic. So to start, we're gonna give you an introduction on how the pandemic started here pretty much at a state level, at a city level, and then what the university started working on, or how we responded to the situation. Then we want to talk about how we got in contact or how we started working on the 3D swabs and all of our challenges and lessons learned, and we're going to end up with the conclusions. So we go to the next slide. So the first case was reported in the state of Texas in March 4th of 2020. The governor declared the state of disaster on March 13th of 2020. And this was the Friday prior to our spring break. The state shutdown, what happened on March 15th. This time, it was expected, or it was confirmed, that Texas had the second highest number of confirmed cases per capita. And that's when Governor Abbott decided to create the supply chain strike force, which was the one that pretty much put us all in contact and working together. Next. So at a city level, the initial capacity for the city of Austin was 26 tests per month. This was early in March. So as you can see, there was like no enough testing capacity here. Most of the tests being done by the city were being sent to the CDC and out of state, of course. There was a big shortage in testing materials and in personnel, in lab personnel. So the city saw that pretty much the biggest priority or the biggest challenge was to increase the testing capacity. And their goal was to be able to have a capacity of 60,000 tests per month by August of 2020. So as we can see in the graph, pretty much the three strongest months for our testing capacity growth was May, June, and July. We started May already with 79, pretty much almost 8,000 swabs. And this was important because by the end of March was when Texas State University started helping or started supplying the city of Austin with swabs. So we can see how our swabs started like working with the city of Austin. Next. So at a university level, our first COVID-related decision was a travel ban issued to all university faculty and staff. This was in mid-February. Then pretty much the Friday prior the state shutdown, when we were heading to spring break, the university decided to go and extend spring break for 2 weeks so we can have a second week to prepare for online classes. At this moment, if you guys remember, we were all thinking that this was going to last maybe 3-4 weeks to maybe a month. We weren't expecting to go all this time. So we had the vision or the idea that we would come back and end the semester fully in person. Of course, this didn't happen, and all classes were suspended and everything was moved to online. And then by the end of March, all research activities were suspended at a university level, which was kind of critical for us. Next. And then this was when the state of Texas initiated the supply chain strike force. So the idea was to reach out to local organizations and see if they were able to either provide or help producing PPE. They were looking for face masks, gloves, lab coats. The biggest concern was that at that point, we were thinking that Texas would be facing New York-like conditions. So if you remember at the beginning of the pandemic, New York got hit really hard. And we were thinking, or they were expecting that the state of Texas would face the same situation. They were also trying to see if communities could see, how could they help to address or to reduce the gap in the supply chain. And that's when we started getting in contact with them, and we saw that we had not only the resources, but also the means to help. There was a lot of people here willing to help. We had pretty much, most of our labs were shut down and all of our academic units were also closed. So we had space to help. Next, please. Okay, so this is pretty much like a small schematic on how things went down. So we have the governor's strike force looking for or to increase PPE production and improving the supply chain gaps. And they got in contact with the city of Austin, and the city of Austin was trying to increase the testing capacity and especially getting more test swabs. So we got in contact with the city of Austin, and we saw that we could provide PPE for medical personnel. We could also help them with test swabs, and we can also help with protocols like safety protocols for not only students, but also their CD staff. And this was also interesting because when we started working with this or with the city of Austin, we got in contact with external companies, for example, Sonic Healthcare and Dell Technologies, who decided to support our efforts, and we were receiving help from them. So it's interesting because we can see how we have the government, I mean, we have academia, and we have industry all working together, all working pretty much to reach the same goal, all working to increase the testing capacity and pretty much making a safe environment or a safer environment for all of us. Next, please. So, yeah, so here at Texas State, especially this project, the SWAP project, was handled by two departments. One was the Department of Physics, and the other one is Shared Research Operations, or SRO. So the Department of Physics, we are a unit, or we are a department inside of the College of Science and Engineering. We're one of the smallest departments, but we are one of the departments with the highest amount of sponsored research. We have three main focuses. We do physics education, astronomy, and materials physics. And then we have SRO, which is pretty much our core facility or our core labs. They support a wide variety of scientific research. They have a wide variety of equipment, from full-size clean room to electrical characterization equipment. So we work together a lot, and we also have a lot of great stuff there. Next, please. So yeah, so once we started seeing how things were coming here in the university, we started looking for things that we could do to help. So one example is we got in contact with the Student Health Center, and they started asking us if we could do something that could help them alleviate the stress or the pain of wearing a face mask the entire day. So one of our students came up with the design below with the ear savers. And then we started 3D printing these initially for the Student Health Center. And then we got in contact with the School of Engineering. They have a big makerspace with plenty of 3D printers. So they started like mass producing these the savers. We were also doing face shields that were also 3D printed. And these was also with the help of Dell Technologies that I'll talk about that later. We were also making air purifiers that the idea was to meet the CDC guidelines for air circulation, which is around 10 to 12 air changes per hour. And an interesting note here is that when we started working on these, we started checking all of our buildings, and most of our buildings and campus weren't meeting this requirement. And it was pretty much a guideline, or it was a requirement that got passed for a while. So we were able to get most of our buildings also like up to code, let's say. And we were also making sanitation stations. We had these outside of our labs, out of our research spaces. So we had hand sanitizer, ethanol, wipes. I'm showing people how to kind of like disinfect themselves or sanitize themselves. And then the College of Health Professions also donated masks, gloves, ventilators, and PPE to personnel and to like communities, to hospitals. I don't know if Dr. Rody wants to add something here.
Sure, just quickly. Thank you. Thank you, Dr. Gomez. So as chair of the Clinical Laboratory Science program here at Texas State, one of the immediate things that happened with me was that I was appointed as a virologist to kind of help with dissemination of information, best research available at the time to make the campus as safe as possible and so forth. In that, I also kind of got tagged in with Dr. Gomez and some others, or many people involved with this effort, and was able to kind of start helping in that regard. So yeah, one of the great things that we were able to do within our college, which includes nursing and respiratory care and many others, was to immediately start asking, are there things we have in our possession that we don't need right now because we're not doing labs or things like that, and then even clinicals were suspended. So our respiratory care unit donated multiple ventilators to local hospitals, and then the other variety of things that Dr. Gomez mentioned, we gave up freely just to get that out in the community to help many of our alumni in these hospitals to be self-protected during their work. So thanks, Dr. Gomez.
Thank you. Yeah, so if we go to the next slide, please. So yeah, so once we start working with the 3D, the pre-printed nasal swabs, so the important thing here was that we kind of have already a design. We were already working with Formlabs, which is the manufacturer of our 3D printers and also the resin that we were using. I might tell you how we do our testing and how we ended up increasing the support or increasing the testing capacity in the city of Austin. Next, please. So when we started working with the city of Austin, they told us that they were in need of test swabs. But this time, or at this point, we were already in contact with Formlabs, and we were working with them, trying to come up with a good resin to make our our face shields, because when we were trying to do this on our FDM printers using regular ABS or PLA, they were too brittle. And as we know, ABS and PLA is not resistant to any solvents. So we're trying to look for we were trying to find a solvent resistant resin. So when we started talking with this, we mentioned to them that the city of Austin was trying to get swabs, and if they have any idea of this. And that's when they told us that they were working with Norwell Health and the University of South Florida on making swabs. So they told us that they had 2 test swabs that they already had tested and pretty much approved through the process of, they were doing sanitization, autoclaving, and an actual like sample collection. So we asked if we could have we could get their files or their designs, and they agreed to this. They sent us the 2 designs, and what we did was we 3D printed 1,000 swabs of each. So we make a small batch of 1,000 swabs per design, and we send these to Sonic Healthcare, and they were in charge of testing the 2 designs and see which one was more efficient or more appropriate for them. Next, please. So once we talked with Sonic Healthcare, and once we saw all the differences between the 2 designs, we come out to the conclusion that the best design for them and for us would be the Norwell Health design. It was because since you can see on the picture on the right, the swab on the left is the USF design, and the swab on the right is the Norwell design. So the Norwell, since it's a little bit thinner, it was more flexible. And when you are doing nasal swabs, you want more flexibility, so it's not as, it doesn't hurt that much, let's say. I mean, still hurt it, but and then it was also like 12 millimeters smaller or shorter. So this meant that we were going to need less resin because it's thinner and smaller. So we were using less resin, and that was improving or shortening our manufacturing time, which was better for all of us. But the biggest reason why Norwell decided to go with why Sonic decided to go with the Norwell design was because the Norwell design has 2 little holes on the swab area where they have the little the little hairs, and those holes allow to pretty much like take more sample or take a bigger sample, which increased the viral load, and that was good because it could reduce the number of false negatives. So it was, let's say, a more accurate way of testing or of collecting a sample. Next, please. So yeah, again, talking with Formlabs, we were using their surgical guide, which is a biocompatible resin, and it's already, it meets all the solvent disinfection and autoclave sterilization standards. So it was fully tested and fully approved by FDA and all the regulating agencies. The picture in the bottom shows how pretty much how we were sending our batches. So we were printing each batch. Each batch was completely labeled, and we were doing QA on our batches before we send them. And then they were sent to Sonic Healthcare, and they were autoclaving them and also packaging them, and then sending them back to the city of Austin to APH for testing. Next, please. So the most important thing here was the quick adaptation that we were required, or that we had to face to meet the city's demands, right? As we know, I mean, we were facing this, or we were in this situation where none of us knew what was coming next or how long was it going to last. So we're trying to pretty much keep up with the pace and keep up with what the city was asking from us. So since we already had we already had 2 designs available, we didn't have to come up with a new design. So that pretty much improved or reduce our production time. We were able to to test these 2 swabs or these 2 designs, send them to Sonic, and they were able to do their test pretty much quickly. So we were able to ramp up our weekly production to 7,000 swabs per week in, I think it was like in less than 10 days. And the very interesting thing here is that when we started doing this, we got some of the local TV channels got in contact to us, and they wanted to do a story about this. So they came here, they made a story about how we were making the swabs. And when the story aired, that's when one of the engineers from Dell Technologies contacted me, and they just wanted to see how could they help us, how could they provide us support. So they were helping us with this. They were helping us with resin, with printers. They were helping us with the face shields. But it was interesting to see how these guys were also aware of what we were doing and aware of the city needs and willing to help right away. Next, please. So yeah, in summary, on the swabs, we were able to manufacture 7,000 swabs per week. All these swabs were shipped to Sonic Healthcare for sanitization and packaging, for autoclaving and then individual packaging. And all the swabs were used for testing at the city of Austin. So they were being sent to Sonic, and Sonic was shipping them to the city of Austin for APH to do their testing. And at the end, our total production was of about 100,000 swabs in over 14 weeks, which, I mean, it was a good run. It was pretty challenging, but it was a really nice or really good experience. Next, please. So yeah, we helped the city of Austin achieve its testing goal. We helped them to get to 60,000 swabs 60,000 tests per week. Through our design test, we were able to optimize the sample collection and being able to provide an accurate testing for COVID testing. We improve our manufacturing process to increase our yield and pretty much to almost eliminate our rejection rate. We also raised awareness regarding on-site safety and circulation standards, pretty much like I told you before, when we started working with our air purifiers. And yeah, we saw how we were able to create new collaboration opportunities between academia, industry, and government agencies. Sometimes we think that academia is a little behind or it's a little tricky to work with them. This time, at this point, when pretty much all of us or all of the 3 parties were looking at the same goal, it was pretty easy to work with. Next, please. So yeah, in our biggest challenges were like as I mentioned earlier, um, sorry, when the university shut down, we had to pretty much start talking to our vice president of research and also with our president at the time to allow us access to our research spaces. Luckily, they were in favor of this, and I think also this was thanks to Rody. So we got a kind of like an exemption, and we were allowed to use our research spaces for COVID-related projects. We also face a shortage of 3D printing supplies like resin, tanks, bags, and uh, general supplies. Luckily, Formula was able to help us there and provide with what we needed. And yeah, also making sure that everybody on the team was working in a safe environment, that we were following all of our COVID protocols, that there was no transmission within the team, and that we were following over all of our rules. Uh, Keeping the quality of our raw materials and the finished product, I mean, that was pretty important for us. We have to keep track of all of our resin tanks. Like, if we know that we can only use them for 3 batches, keep track of all that, replace every time, make sure that we, like I told you, like I said before, make sure that we almost reduce to 0 our rejection rate. And that means that we were able to pretty much send 100% of our swabs. And then I think the biggest one was the general uncertainty. I mean, we all knew that at that point we didn't know what was going to happen. We didn't know what was coming next. I mean, we didn't know if summer session was going to be in person, if the fall semester. We didn't know how things were going to look a week in advance. Next, please. So yeah, for lessons learned. Yeah, the first one is the importance of being able to identify what the need is. So the fact that we had the strike force and the fact that the city and the state were already in conversations, and when we met with them, they already told us, this is what we need, what can you help us with? I mean, that was really important. We really reduce, or like pretty much reduce our time of pretty much like wasting time in meetings by a lot. We were able to work with numerous entities, like I said before. I mean, we were working with government agencies, academia, and industry. Um, we had like really an amazing leadership here that was helping us and was supporting us with everything we needed. We were able to optimize our manufacturing process by reducing our time by going with the swab that was going to make our batches or our production faster and more efficient. And we were able to keep calm as much as we could and keep our students safe, or and also keep our staff safe. And we were able to maybe eliminate some of the administrative barriers that sometimes are here that prevent us from being able to react as fast as we reacted this time. Next, please. So yeah, in conclusions, yeah, so physics and SRO and generally pretty much all Texas University was able to step up and help the community. Yeah, public health agencies can reach out to universities. I mean, we can work with them. We are here to help, and especially during these times of crisis, I mean, we step up. Not only we were able to help, I mean, we also got support from them. Like I mentioned before, I mean, there are some administrative barriers that were key to to the success of the element, and removing these and still being able to work with our boundaries and following all of our protocols was really important. I think our biggest conclusion here was that, I mean, they were, like not to underestimate the willingness of people to help out in the time of, in a time of crisis. Like once this happened, everybody from all of the departments across campus starting to see how they could help. When they saw what physics and SRO were doing, we started getting emails and calls from people from chemistry, biology, math, a lot of departments offering help. So this was really, really nice or really good for us to see like how people were willing to support us. Next, please. Yeah, so this is pretty much a list of our most important or for collaborators. As you can see, I mean, a lot of people in Texas State was involved. We also have people from the city of Austin, people from Dell Technologies, from Bozart, from Sonic Healthcare, and from Formlabs. Next, please.
All right. Thank you, Dr. Gomez. Again, I want to applaud that effort by your team. And as you just mentioned on that last collaborator slide, I know Dr. Gomez agrees with me that that's a very short list of, a lot of players that were involved from all levels, from administration all the way down to students and graduate students and throughout the area. One quick Q&A question that popped up that I can address right now, and then we can pop some over to you, Dr. Gomez, was what led the city of Austin to work with Texas State based in San Marcos rather than UT Austin on this project? My understanding is that the city of Austin worked with UT Austin as well. There were multiple entities, as you can expect in this area. We're really close to San Antonio, Austin, and even Houston's only 2.5 hours away. Dallas is about 3 hours away. So we're in a really prime location. Texas State is right in the heart of the I-35 corridor between San Antonio and Austin. So I don't have specific names, but I know UT Austin was very involved, as was Texas A&M and likely many other universities, including community colleges. So quick question, Dr. Gomez, we've got a few here for you. How did you and your team, or maybe you can talk about your team as well, kind of ensure that we had university leadership kind of to buy in to support this coordinated multi-departmental effort? And maybe was there a project funding with that? So I know you kind of talked about how important that was for administrative barriers to be lowered. I know I had my own experiences with that, but do you have any thoughts on just that with respect to kind of getting that buy-in early on, and if there was any funding issues?
I mean, initially when we started working on this, we were all of our funding was coming pretty much from either department funding, or we had a lot of support from the Materials Applications Research Center, MARC, which Dr. Myers led at the time. So we were counting with that support. But once we started working, like I said, once we started working with Sonic and with Dell, pretty much they were giving us all the funding. This is also clear, to make clear, they were funding all the materials, they weren't paying for labor. So we were working, we were working just to help here, but Dell and Sonic were buying all the pre-printed materials and all the supplies that we needed for our manufacturing.
Yeah, great. I know that probably the audience knows this, but Dell Computer is in Round Rock, which is also where our campus, Texas State Round Rock campus is. We have a campus about 45 miles north of here that's mostly healthcare, but also some other entities. So we have a connection there with Dell. And then of course, Sonic Reference Labs is an interesting side note. That's a huge reference lab in the North Austin area that our students in the medical laboratory science program actually do clinical rotations with. So again, just a really nice opportunity to collaborate across all those spectrums. In your opinion, what role do you see of 3D printing for public health emergency responses? How can we better mobilize maybe to reach out to labs like yours or other academic labs to kind of help public health understand these opportunities, even if it's not, I'm thinking, even if it's not a public health emergency, do you see, in your opinion, of ways of how 3D printing or other technologies, in your opinion, that might be useful during these types of issues?
I mean, 3D printing is it's a great manufacturing technique. For additive manufacturing. The biggest challenge here is we all know there's a big disconnect between, let's say, engineering or the engineering field and the medical field. There's bioengineering and there's like some fields that are trying to get together right now or that they're mixing. But we use 3D printing for a lot of things here. We do it for a lot of prototyping, but there's also now some materials like these kind of resins that are already biocompatible. So you don't need to make a test part and then go actually make it on the material that you're actually going to use. So this is a really good technique, or this is a really good process that, a good way is pretty much, if we could come up with a way of making the engineering field work closely or work more with the medical field, seeing what each field needs from each other, and kind of support by that.
Yeah, I totally agree. I know in my efforts in this alongside you, one of the things that quickly came to mind when this happened was just that communication route and that chain. And so again, I hope one of the lessons we've learned and we continue to learn is that, the siloing of expertise is really a thing, really needs to be a thing of the past. Whether it's engineering, healthcare, food safety, nutrition it's all the way across any university campus. And so, I think we need to ride this wave of how critical academia was able to step in and help, but it certainly will be a two-way street as we move forward on that. One of the neat things I know that you're familiar with in your area, Dr. Gomez, is the MSEC program and some of the other programs over there that actually have doctoral level programs now that have students, PhD students, taking courses in marketing and business and entrepreneurship alongside their actual science expertise. So, those types of future majors and opportunities, I think, will be great. In your experience, what are the advantages and disadvantages you think that academia can bring to a pandemic response? Do you see, where do you see flexibility or restrictions in academic settings? I know you've talked a little bit about this, but can you point out any that were really problematic or maybe not problematic that helped move things along?
I think we talked about this when we had our first session. One of the where we could have more flexibility, let's call it like that. And this is only, when everything was starting, but we were still working on site, we got an email from, I don't remember, it was from a local hospital, and they told us that they were in desperate need of any kind of PPE. So here being in our labs, we work with a lot of we do a lot of semiconductor research. So we had a lot of nitrile gloves, lab coats, isopropanol, ethanol. We got as much as we could, and we just told them, hey, we have all these, come pick it up. We did that, and then we told university that we made a donation, and that ended up being a huge deal because we didn't ask for permission to do it. So yeah, that's kind of something that we can have a little bit more flexibility. Okay, yeah, maybe we didn't ask for permission, but come on, look at what's going on. It's not that,
Right.
But I have to admit that we were also impressed on how the university adapted so quickly. when, I mean, we all were here trying to make everything easier or better for everybody. And when we started working on our COVID protocols and trying to make everything safer, or like the lab space safer for everybody, the university was helping us and was like open to any suggestion from our part or any comments. So I think that's also like really important to bring up, like how like some people might think that the universities are really close-minded and there's only this way and this way to do something and there's nothing else. But at that time or at this point, we actually proved that they were really open to listen to us and to work with us, and we actually saw a big improvement there.
Yeah, I would definitely concur. I know one of the things that you mentioned in your lessons learned, and I would, as someone who's worked in public health and medical laboratory for 30 years, and I've lived through several different endemics in Texas that I've worked on personally, the action step for leadership is so critical. And I would even say that, and our university administrators were wonderful with this. They took the best data they had, they listened to the experts on campus and surrounding community, and they made decisions and they moved. Because if you don't do that, as you know, it's paralysis, which can be just as maybe more traumatic. So even if you move and you make mistakes, you learn and you back up and you move forward. I mean, that's the definition of science. So I thought Texas State and your team and others did such a great job there. I've got a couple of questions. Let's see if we can get to them in the Q&A. One I really want to ask, because this gets into kind of the quality issue. So one of our participants asked, were you asked to comply with any medical manufacturing standards such as GCMP or ISO standards? And if you were, did you find this as a good opportunity to introduce your students to them or your staff even?
So we weren't asked to comply with any of, I mean, or like official standards. What we were working with was pretty much following our Formlabs protocols and the Sonic Health standards. We were printing them and then we were just sending them to Sonic, and they were doing all the actual official QA. So yeah, we couldn't introduce any of our students with this. It's also important to know that during this time the university was closed, so we technically didn't have any students here. We only had pretty much my team or our team. But yeah, I kind of show them how to do a QA or how to do a good statistical control, but it wasn't anything official and it wasn't anything like for class or for experience, right. I would say.
Right. Yeah, I would agree. We actually, in the College of Health, we actually did have students here. I'll never forget this day. Many of you probably didn't either. It was Friday, March 13th, Friday the 13th, and we quickly pivoted to a 2-week spring break, and our students lost out on clinicals and other really critical things, but we actually got an exemption to get our students back that summer. So we were the first back on campus, and we spread out, we did all the masking, we did everything correctly. But we took advantage of this pandemic to actually talk about the same things that you were just asked, like how does this impact laboratory testing? How does the public understand what a false positive is and what a false negative is? How do you combat public misinformation around these issues? So it was really a good learning experience right in the middle of a sandbox of a pandemic. So invaluable. Maybe the last quick question, and maybe I can answer this and Dr. Gomez can respond if he wants to, because we're getting close to end here. One of the participants asked if our students' health insurance helped cover the test on the campus during 2020. During that time, they mentioned that A&M system distributed about 15,000 free tests across 11 campuses. And we did offer free testing for students, faculty, and staff. In combination with reaching out to different entities to actually do stand-up testing out on our quad and places like that. So that was really interesting, as well as the ongoing efforts to kind of provide that safety and features around that with students and faculty that were, again, remember, really uncertain and really worried during this time when they did get back to campus later on. So I think that that gets us a little closer to the end. I'm curious if we might ask a couple of more questions here with respect to overall, throughout the pandemic, what really motivated you to respond to the City of Austin's challenge? How did that look? Was it a team, personal, do good for everyone type of thing, or was there also some other factors with respect to kind of what motivated you to respond to the City of Austin, to that challenge?
I mean, I think the first thing that crossed through our minds was looking at all of our equipment and just seeing that they're sitting, doing nothing. So pretty much thinking that we have the capability or we have the means to help. I mean, we should do it, right? So it was a team effort. I'm not gonna say that it was only myself. It was a team effort when we got the first email from the city of Austin. I met with Tom Myers and we were discussing this. So I met with my students and we decided to give it a try. So before we did the first 1,000 swab batch, we just printed like 5 or 6 just to see if the printers could handle it. I mean, we wanted to have an idea of what it would take before we take on the challenge, right? So, but yeah, I think our biggest motivation was to help. Everybody wanted to go back to normal as soon as possible. I guess.
Yeah, I know when I reflect back on it, Dr. Gomez, one of the things I remember, we kind of mentioned this in a past conversation. So much, it's been 3 years. And one of the great things about these webinars and these opportunities to do this is to kind of refresh our memories around what we did and what we didn't do. And I remember, so much effort from everyone at the beginning, and a lot of ideas kind of fell to the side. And one of the ones that I remember we kind of were trying to address in that first month or two is, you might remember Tom Myers and you and some others, we gathered and we had a military visit with several key leaders, and I forget their names at this time, but they came in and we were actually looking at building not only testing, like portable testing that would be safe. So they were looking at different ways to put in negative pressure and to kind of putting them on wheels, literally, and rolling them to different parts of Texas where you could set it out in a shopping center or something like that. Really extravagant and creative ideas to build those units with. How do you do that? Well, with small areas? Do you have access to electricity? Do you need to bring in generators? Do you need to do different things to create a sterile environment? And then the idea was that we would build them and be able to pivot quickly to vaccination centers, because we were already thinking in April that we are hopefully going to have a vaccine soon. And so the idea was that we would pivot. And as that ended up kind of not happening for us, but certainly we saw that kind of innovation going on around the country where we started vaccinating I took my parents to Brenham, Texas, and we got vaccinated inside of our cars, right? So all that kind of vaccine stuff happened with cars. And I just think it was a frustrating, scary time, but it was also, as a virologist and public health professional and medical laboratory professional, I'm sure you as a physicist and a scientist, one of the most interesting from a creative standpoint under pressure. It was like so many flooded ideas, and some got tossed to the side and some got utilized. And so I'm really appreciative of not just this team, but so many people across the country that were able to step in and do that type of work. Do you believe the network that you and your team created through this effort has the potential to further collaborate on ongoing projects or other urgent projects? Have you had any follow-up, or have you found any opportunities? I know our university is really pushing for these industry collaborative types of things. I'm curious if you've had any follow-up there.
No, actually, yes. It's really interesting. I mean, after this, we have maintained contact with the 2 people from Formlabs and the 2 people from Dell Technologies. to the point that one of our team members got a job offer from Dell when
Oh,
they
wow.
graduated from their master's degree. But it was, I mean, yeah, we keep in contact. We haven't worked in any projects since this, but we always talking about, I mean, the opportunity, if the opportunity arises, and also Formlabs is willing to help us if we need it again.
Well, that's interesting. Yeah, right on that. That's the kind of stuff that's kind of cool to hear, those types of ongoing collaborative projects. I know if our audience was here for our last webinar a few weeks ago, we had kind of a New York situation with respect to how they handled it. And one of the key, I think, lessons I heard, and I would agree, was that they created this amazing network of people that probably hadn't worked together before. And they started creating, weekly meetings through Zoom and other things that we had never really done before. And they built a coalition. And one of their primary things that they did that stuck with me was that New York in general has, it's difficult sometimes to work there from a medical laboratory standpoint because they have a little different clinical training and restrictions around that. But they actually looked at not lowering quality, but they looked at less red tape and ways to get things through, and that happened, and they kept it, which has been a benefit, I think, going forward for people who want to work inside or outside of New York. So those things I think happened here too. I just, as I look at everything, there's so many lessons, right? I know Dr. Gomez agrees, but this ability in a quick moment to remove some of the hurdles and things that we all work around, whether it's academia or professional organizations or industry, and they worked, and we didn't sacrifice quality. And so I hope that we all kind of keep that in mind going forward, because that's the sort of stuff that helps us move forward, whether it's an emergency or not. So I don't see any other questions in our Q&A. And I think we've gotten real close to our deadline. So I think I'll transition now to my colleague, Dr. Brown, who will take us through our next steps. Thanks, Dr. Gomez.
Yeah, thank you so much. What a great talk. And, as people working in the laboratory, we often serve silently, but everyone in the healthcare system stands on our shoulders to better take care of our patients. And we even stand on your shoulders in that. So just thank you so much for all that you did for our patients during the pandemic and for all the things you continue to do.
No, thank you guys for everything you have been doing.
Yeah, thank you. So this brings us to us promoting our next session that's coming up just over 2 weeks from now. So you can use this QR code to register for it, or you can visit our website. So we want to pause here for a second to give folks the opportunity to access this QR code. This presentation coming up will feature a case study from Dr. Amy Kirby from the CDC. She's going to talk about a very exciting topic of how one can use wastewater surveillance to understand infectious disease trends and how collaborations are essential to this system functioning effectively. Again, we're talking all about collaborations across this different aspects of healthcare and beyond for this series. Next slide when we're ready.
Yeah, I'm also excited about the next webinar as well, because what a phenomenal tool using wastewater surveillance. I've read some really great peer-reviewed research around using wastewater even at airports or other places or urban centers, where you literally can start tracking more quickly than looking at cases, right, that are coming into the hospitals or things like that. And it makes really great sense to utilize that. So really excited about that. So I hope you guys will check that out and share it with your colleagues so that we can take the biggest advantage of that opportunity from Dr. Kirby. Want to talk a little bit about encouraging all the attendees now to continue engaging with laboratory peers and staying up to date with cutting edge laboratory testing trainings through joining the OneLab network and signing up for access to the CDC OneLab Reach. And so there's some QR codes here to check out that show CDC's new LMS for laboratory training materials. You can stay up to date with ASCP's work supporting the One Lab initiative and several new resources in our pipeline, including past and future Building Bridges resources and registration details on our website here. I believe that concludes our session. There's the slide QR code if you're interested in checking out that and updating your resources and checking out the website as that becomes available to you. I know I'm really excited to watch the progress and the build out of this as we move forward. And you can see some of the other things coming up: supply chain management, negotiation and advocacy toolbox roadmap, and a new micro learning course on effective test utilization. For those of us in the medical lab, we know how critical that is.
Yeah, we're really excited to launch these toolkit type resources. I've had a chance to look at them and they're really fantastic. So we really are looking forward. Please go ahead and check out our website. We also have volunteer and consultant opportunities for those of you who are doing some innovative things in your laboratory who would like to share them with us. So please go ahead and visit our website and we would love to hear about what you're doing as well. Thank you so much for joining.
Thanks, everyone. Have a great weekend and a great day.